This is Dr. Ripal Parikh with Regen Medical. Today I wanted to talk about sciatica. Now, sciatica is a very general term, generally for pain in the lower back, buttock, and down one or both legs. But the true diagnosis of sciatica is really supposed to be inflammation of the sciatic nerve, generally around here going down the back of the leg. But again, sciatica is oftentimes used to talk about back and leg pain. Now, there's a lot of different potential causes of sciatica. It could be the joints in your back. There are a lot of ligaments in this area. There are discs. There are, of course, muscles. And depending on who you go to, you can get multiple different causes of it. A massage therapist will talk about the muscles. A chiropractor will talk about the joints being out of alignment. A spine surgeon will likely talk about the discs. But it's not a simple diagnosis, and oftentimes you have to get a good history and do a physical exam. For instance, if you were good one day and then the next day you started hurting, and let's say you got an x-ray soon after and the x-ray showed, oh my god, you got disc degeneration, you have arthritis in your back. Well, guess what? It was most likely there before you started having pain, because x-rays don't generally show something that can happen from one moment to the next unless it was a broken bone. So that arthritis or disc degeneration you had, again, was there beforehand. So the real question is, what is it? Well, the most common cause of acute new onset lower back pain is actually ligament and tendon strains. So something gets pulled and then you start hurting. And so the key is really, how do you help the body to heal after that initial injury? And so when a massage therapist says it's the muscle, and a chiropractor says it's out of alignment, and the surgeon says it's a potential disc, they're not all wrong. There's probably a component to all of them, but if it's a very new pain, it's, again, a lot of times it's more of that ligament and tendon. So that massage therapist and that chiropractor can really help you through that process. But let's say you've had it for a while, you've been through massage, you've been through chiropractic, and you've seen a surgeon and said, you got bad disc, you need surgery. Well, again, I'm going to go back and say, let's look at how you did or did not heal from that initial injury. So if you saw me early on, number one thing I'm going to talk to you about is how do we support your body through healing? And if you've had it for a while, let's say, okay, how can we now restart that process of healing? So again, it could be proper exercise, again, proper diet, could be some manipulation. It's a whole host of things. So again, sciatica, back pain, buttock pain is generally not one thing, it's a number of things. And so what I like to tell folks is give them a number of potential causes, and really based on their history, which is really, really important to really figuring out what's going on. So take it from this to this is focused. This is what's going on with you, and this is how we're going to address trying to get you better. So that's kind of how I look at back, buttock, sciatica pain when I see my patients, and help them through that process of recovery. So hopefully that was beneficial. If you liked it, certainly share with your friends. If you'd like to see me, give me a call. Thanks. Or you can certainly check out my website. Thanks. Bye.